the DISC recovery program. My name is Dr. Jim Powell. I'm a second-generation chiropractor at Powell Chiropractic Clinic, and I'm here to describe to you the DISC recovery program. The DISC recovery program has been 50 years in the making. Powell Chiropractic Clinic started in 1970 by Dr. James P. Powell, my father. We've had the privilege of treating disc patients our entire career. We discovered an aspect of a program and a unit that we use that has improved our disc recovery at our clinic substantially. The reason that we have that is because a patient, Pastor Don Bartow, that created the Total Living Center in downtown Canton, came to me after watching an infomercial on TV. As a patient, he was unfortunately diagnosed with a herniated disc of L5, and he was in extreme pain. He said, "Jim, it feels like that I should do this decompression table. You don't seem to have one, but do you know anybody that does?" So I sent him to a friend of mine. He received 24 treatments, 30 minutes apiece. He had zero pain relief till the 24th treatment. On the 24th treatment, he had 100% of all low back leg pain gone. And now this is 14 years later, still zero low back leg pain. So that event changed things for us. When I brought Pastor Bartow back to the clinic, I took another x-ray. So this gentleman had scoliosis. He was in his late 80s when he came in to see me. His scoliosis changed and the thickness of the disc. Because of that event, we knew we had stumbled onto something that would monumentally change the way that we treat disc herniations. The vertebral disc is a very unique structure. Its purpose is first to act as a shock absorber between the spinal segments. In addition to being a shock absorber to absorb our daily compression, it also acts as a pivot point. Your knee basically bends forward and back. It doesn't really have any type of rotation. The spine not only does forward and back, but it does lateral flexion and rotation, and then combinations, bend forward, rotate, and turn. All of those together are only possible because of the pivot point that the disc offers. The anatomy of the disc is unique. As you can see in this slide, the outer membrane of the disc is called the annulus fibrosus. The center of the disc is called the nucleus pulposus. I'm not going to quiz anybody on these terms, but just know that they do exist. This pivot point that we talked about before is only possible because of that nucleus pulposus. And as you can see in this particular slide, the nucleus being in the center of this disc, this nucleus, contains a chemical. And this chemical is called proteoglycans. Proteoglycans are one of the most unique chemicals that we know. It can absorb 500 times the weight of the chemical in water. So it's very water-loving. It attracts water. When the disc itself causes pain, there are two different sources of this pain. We'll call one direct and the other one indirect. The direct pressure from the disc is that when the disc itself touches a nerve, that is direct pressure on the nerve causing pain. And indirect pressure is that center portion of the disc, the nucleus, contains proteoglycan chemical. That chemical can leak out of the disc, and it's almost like hydrochloric acid on a nerve. So you could have nerve pain and not have a herniated disc, but coming from the chemical. But more commonly we see the disc itself migrates out, touches the nerve, and causes direct pain. Stages of herniation. Herniations typically do not happen by one event. They can. Significant traumas. But more commonly, it's the person that bends over to pick up a pencil off the floor and blows a disc. How did that happen? Well, it was over time. The water leaks out of those disc spaces, allowing them to get smaller and smaller. That's degeneration. Then that center migrates out towards the outer rim and penetrates the nucleus penetrates the annulus, goes out into the space, touches the nerve. That is a herniated disc. Many people will say, well, why don't I choose surgery if the disc is leaked out, cut that piece off, and I'm fine? Surgeons will tell you this. Your general practitioner will tell you this. Try everything else first before surgery. Why is that? Spinal surgery, unfortunately, has a 50% success rate at 5 years. It doesn't matter what surgeon, what style surgery you have done. Surgery changes the biomechanics of the disc, changes the biomechanics of the spine. And so there's typically 5 out of 10 or 1 out of 2 have a second spine surgery. After the second spine surgery, your success rate goes to 20%. So typically you'll hear of somebody that has had multiple different spine surgeries. And if you ask them, did they try everything else first? Most of the time they have not. Those spine surgeries have a tendency to become constant pain. This constant pain is dealt with in a medical aspect, typically with opioids. Now, we all know how negatively the opioid crisis has happened in the United States. And so you don't want to walk down that path unless you've tried absolutely everything else first. The decompression thought came from a medical doctor out of Canada. His name is Alan Dreyer. And Alan created this in 1985. And the purpose of his thinking was that if the degenerative process of the disc, losing the water, if he could reverse that process whatsoever, he could change the outcome of the disc down the line. So he created a table called VAX-D. Now, VAX-D was created and launched in 1991, and since 1991, technology has improved the decompression table substantially, and we'll be showing you that here shortly. In 26 years of practice, what we have discovered is it's typically never one thing that makes the big home run hit for anyone's healthcare. It's typically a combination of a wide variety of different things that work put together that gives you the greatest result and gets the greatest success for whatever health concern you're looking for. That's no different in the DISC recovery program. The DISC recovery program includes the decompression table, but there are other aspects that we wouldn't have the success rate that we have, 90% of the patients that we accept. So we utilize 5 categories that we have put together into one program, and that's where we have seen the greatest success. The conditions that the DISC recovery program has shown tremendous benefit for: herniated discs, bulging discs, degenerative discs. There's lots of pain syndromes: pain down the arm, pain down the leg, pain in the neck. Some people are more of a pain in the neck than others, but that's okay. Low back pain. All of those together, if the disc is causing the irritated nerve root, whether it is a direct pressure where the herniation comes out and touches the nerve, or an indirect pressure, either way we have had a 90% success rate using our program. Our patented discovery program, the DISC recovery program, begins with a chiropractic adjustment. As you can see in this slide, the vertebral segments on occasion will lose their normal function, their normal flow or flexibility. If that joint gets jammed, and the purpose of the decompression table is to increase the disc space, if the joint's jammed, you're going to have less success if that joint is misaligned. We call that misalignment a subluxation. So every patient receives a chiropractic adjustment to ensure that the spinal segments are in a line and as flexible as possible. Flexibility therapy is something that we've coined, and we have taken 2 separate treatments, blended them together, and put them into a very effective method to increase the blood flow and the interstitial fluids, which are your clear fluids, water, plasma. So what we do is we put you on a table. The table bends, elongates the spine, and then comes back to its original position, allowing this to flush the fluids throughout the spinal area that we're going to be treating. The other item that's being used in the flexibility therapy is the percussor instrument. The percussor instrument was invented in the late 40s, and its purpose is to exchange fluids or to get fluids movement. It's a vibrational therapy. Now, it's not vibration where it shakes you, it's percussion. So its purpose is it actually percusses the tissue, and that percussion is what brings the blood flow in. DRX-9000 is the decompression table that we have chosen to utilize at the Powell Chiropractic Clinic Disc Recovery Program, DISC-covery. This table, as you can see in the slide, is not a little thing. To the left of the patient is the lumbar portion, to the right of the patient is the cervical portion. The purpose of these computers is to pull the spine apart. If you begin to go into spasm, the table recognizes, the computer lets go of the strap, allows the body to relax, then once those muscles have relaxed again, begins to pull again or decompress. Traction is where you pull on the tissue, you pull on the joint, and it doesn't let go. The difference of decompression versus traction: decompression elongates and allows the spine to return to its normal position, elongate and return. Traction pulls and doesn't let up. So that's the difference between decompression and traction. The DRX-9000 table does decompression. Not all decompression tables do the same thing. Not only have we found a 90% success rate with herniated discs, but other entities, good sources of research have been done. The Journal of Neuroimaging did MRIs before and after DRX-9000 treatment on patients and found a 90% reduction in a herniated disc. 83% reduction of low back pain is what Stanford University found. So we have individual, separate identities that all have nothing in common, doing research on a program that has been found to be effective. In addition to that, CT scans were performed before and after decompression treatment by the University of California. And they found reduction in pain, reduced disability, and an increase in disc height. Very monumental findings. If you look at all of these together, it shows that the table has tremendous benefit. We feel the combination in the DISC-covery program is where the true success is found. One of the things that we have had tremendous success with for many, many years is muscle rehabilitative exercises of the spine. This is not calisthenics. You're not coming to do sit-ups. This is a machine that will test the strength of your spine. So if you pretended that the knuckles of my hand are the bumps of your spine, the muscles between the bumps are what matter. That's your true core. So the core of your spine is tested, strengthened, then retested to prove that we've made a difference, whether it's your neck or your low back. This piece of equipment has been valuable for our clinic for many, many years, and it's one extra piece in the DISC-covery program that has helped make long-term benefit. How do we get this thing to stay? You got to strengthen the core, or it will not stay. Nutrition plays a huge role in healing. The healthier you are inside your body, the more likely your body is going to heal. And what we found in this particular product, it's called glucosamine synergy. Glucosamine synergy contains glucosamine, a nutritional product for ligaments, but the key component in glucosamine synergy is frankincense. It's also known as boswellia. Why was frankincense a gift for Jesus? Is that if you have cut your arm, unfortunately on both arms, and only put frankincense on one, it'll heal 2 to 3 times faster because the fluids are exchanged at a higher method or a higher rate when boswellia or frankincense is present. When you take it orally in a specific dosage, we have found it to be of tremendous benefit to getting the fluids back into the disc space, which is your ultimate success, is increasing the fluid retention of the disc. As those fluids are brought back into the disc, it pulls the herniation with it. Research is now your responsibility to see what is it that this is, does it fit for your thinking, and is this something that you want to know more about? A good place to start is powellchiropractic.com. And as you can see, as you click through our site, you'll find the DISC-covery program, then in the Discovery program there's a questionnaire. Please take the questionnaire. It'll drive you to another page. Click through the things that apply to you. That'll give us more information if you would be a potential candidate. Not everybody is accepted in the DISC recovery program, so this will help narrow down how our success rate is going to be with you. You also get the opportunity to watch a 6-minute video that describes the DISC recovery program decompression in detail. It's definitely worth your time. Everybody says, how long is this going to take? The answer is pretty simple. It depends on how severe your problem is. We categorize people mild, moderate, and severe, and we do our very best with all of the testing, the MRI results, x-rays, and exam findings to help put you into these categories. Typically, it can really go from just a few weeks of care to a couple of months. The majority of patients, 90%, find 100% improvement of their pain. Another question that we hear quite often is, does this treatment hurt? The answer to that question, it depends on the severity of your problem. On the initial couple of visits, sometimes it can be a little uncomfortable. The majority of patients find significant improvement just after a couple treatments, and 90%, 9 out of 10, have complete recovery of all their symptoms at the end of their program. Patients also ask, well, what am I going to do if I'm the 1 out of 10, where it doesn't work for me? We do our very best to classify if this is a good program for you or not, and there is that 10% opportunity that it just doesn't seem to make a difference for you. There's lots of things that we can do to help direct you, but more importantly, let's focus on what is the difference between feeling pain and receiving benefit or success, health. If the symptoms are reduced, but they're reduced with medication, you're not actually treating the cause of the problem, you're treating the symptom, you're putting a Band-Aid on it. So when somebody receives benefit from this program, they receive true health, not a cover-up of the symptoms. The choice is clear that the DISC recovery program at least should be investigated to determine if it's a right fit for you, and at least attempted prior to any invasive or medical therapy that could be harmful to your body. So we encourage you to spend some time on our website, do research on your own, do patient testimonials that are found all over the web. You'll find significant improvement in a large percentage of the patients that utilize this therapy. Often, the number one biggest question that everyone wants to know, how much is this going to cost? And can I afford it? At Powell Chiropractic Clinic, we take great effort to make sure that we and utilize all of your insurance capabilities, and a large percentage of the patients that come, their insurance covers a large percentage of it. There are going to be patient costs, and those patient costs can be, on a case-by-case basis, put into a monthly payment that you can afford so that you can receive the care that you deserve and not overwhelm your cash flow. So we'll do everything we can to make it work for you and for us here at Powell Chiropractic Clinic. Thank you for your time. God bless.